I'll just,
Yeah,
yeah, the echo is persisting, I think.
I think the reason may be because we are on this one, as we thought before live,
Right.
it did not come. Hmm.
Yeah. Initially it was not there, but I can hear an echo now.
Hmm.
So 2 minutes to go and
Yeah,
the workshop. You can go ahead and mute me now while I do the introduction and then.
sure.
Doctor, you can go ahead and mute yourself.
Okay.
Yeah.
So, hello, I'm Dr. Narmada,
No, no, no.
pediatrician from.
I didn't say, I said you can go ahead and mute yourself. Press the mute button. So I'll do the introduction and there will be an echo. And then I'll hand over you to you too. Yeah. Yeah, perfect. Perfect. We'll just start in a minute. Good afternoon and a very warm welcome to you on this Parent Tune workshop. I hope you and your family are doing well. My name is Jhanna Kukreja and I'll be your host for today. Today we're joined by Parent Tune expert and senior pediatrician Dr. Narmada Ashok for a workshop on important vaccines for newborns which you should not miss. Dr. Narmada Ashok is a pediatrician and the director at Nalam Medical Center and hospital. She has extensive experience in child's health, growth, development, and child's milestones. Dr. Narmada has conducted various health awareness programs for parents. Welcome, Dr. Narmada. And I'm going to start off by asking you, why do babies need vaccines in the first place?
Actually, that's a very important questions we have to be actually answering before starting the workshop, because with a lot of lot of problems which has been discussed about vaccination in the social media, as well as about many people have talked about their side effects. So people are really thinking about whether we should vaccinate. So let me start off with saying that immunization is a very effective tool for controlling and eradicating the disease. If you would have seen, all your grandfather and grandmothers would have had a very big tika over the lower aspect of their arm. So that is one thing which will be very big one, and you cannot miss it. Those times the smallpox was a killer disease, and it had killed many millions of Indians during that time. After the smallpox vaccination, in fact, there were the epidemic of smallpox in the entire world, but the smallpox was the first disease which was taken up for vaccination. That is a very interesting story. But actually, if you all know, vaccination was introduced after the concept came about with Dr. Jenner. He was actually seeing that many people were dying with smallpox, and one of the person servant who was working in his home had acquired a very less variety of the smallpox called as a cowpox from her cow cattle, and that interestingly that servant did not suffer from smallpox even after getting infected when the whole household was infected. So then he sort of analyzed this, and then he used his own himself. He inoculated himself, and that is how he found out about the vaccination. That is why smallpox was the first vaccine to be introduced and used worldwide, and we almost eradicated it from the face of the earth. It's two words I want to tell about: eradication and elimination. Elimination is when we are not having the disease anywhere in the country for the consecutively 3 or 5 years. We call it as elimination. Eradication is when all the countries in the world say that we are not having the disease for 3 to 5 years. We say as eradication. And till now, that is almost. The smallpox was eradicated during 1975. Till now, we have not had any infection at all. Now, the success story is for the polio. Many of us would have known, even our own aunts and all, would have been infected with the polio, and it was a very major debilitating disease. Lakhs of people, it is not the death that mattered. Lakhs of people had they had paralysis. Some had paralysis of the legs, some had paralysis of the hands, and many people are bedridden or wheelchair ridden. So now we have come to a stage when we have completely eliminated polio from India. There is only polio in 3 states. Afghanistan and Pakistan, and that is why we are very worried. We'll talk about the story of vaccination, polio later. But to tell you that once we are eradicating these diseases, the quality of care increases among the people. What was the death rate? If you would see, the average death age of people during the 1940s were somewhere around 35 to 40 years. Now India is actually having a very good average life expectancy for males to about 65, and female it goes till 68 years also. So we are having a very good average life expectancy. And one of the factors, there are goals, SDG goals. That is what we are saying is developmental goals that has been fixed. Initially, it was fixed for 2020, and now they have extended it further. And one of the development goals is to increase the quality of life. And one of the things which is very significant is vaccination. So vaccination helps us to prevent life-threatening or the debilitating disease, and that is the reason it is very important for our nation.
Uh, Thank you so much, Dr. Narmada, for that, brief explanation on why vaccines are so important. So you've told us how vaccines, the role they've played in eradicating diseases which could have otherwise threatened our very existence. If you're a parent like me who does not have a medical background, could you explain, to us how vaccines actually work? What is the science behind a vaccine?
Vaccination, okay. So see, when you are having an infection, your body literally fights against the infection. So it is a war that goes on between yourself and the organisms, right? So in the war, anything can happen. The victory is from the two sides. It can be from either side. One, the disease wins or we win. Okay. So whenever we develop into when we come into the world, there are thousand millions of microorganisms circulating among us. But we are not getting affected by all the viruses, all the diseases, that is all the organisms at all. But we are prone to certain infections. Okay, so we have certain thing called as a basic nature because of our species, like because being a human, we are not getting certain diseases. But being a human, we are more prone for certain diseases also. So that is one thing. So what happens when we come into this world? Because we have some two types of immunity called as an innate immunity and an adaptive immunity. Innate immunity is by nature, by genetic default. We have certain protective factors like our skin. Our skin is very much protective. If you would have seen that you get a small injury in the hand and you don't tend to it, within 1 or 2 days or 3 days, you will see that redness coming. It will slowly go into the pustule. Then you will have to go to a doctor either to take away the pus or you will have to take some medicines for it. So that is, which shows that without that skin barrier, the infection would have spread much earlier. It would have spread into the body. So skin by nature, it is an epithelial barrier. Then as soon as the organism enters into the body, you have some sentries, like you go to a fort or some parliament building, no, you have entry, you have one check of soldiers, so that they will check your initial identity card and all that, right? So similar to that, we have these phagocytes and dendritic cells that will recognize whether this is someone who's belong to this body or someone who's coming away from it. So the moment they know that you are someone who's not belonging to this body, then he will stop you there and ask for your ID card. So something similar to that will happen with phagocytes and dendritic cells. Definitely, he knows that ID card is fraud. Then the entire sentry comes and barges you, and they will put you into jail. That stage itself, like that, when they know that this organism is not good for you, then they will fight against that at that point of time itself. But sometimes you have a little valid ID card and it looks something similar to it. Then the body thinks, okay, maybe I need to ask a higher order permission. So what it does, it sends the signals to the adaptive immunity. Just go back to the earlier slide, Jana. So if you would
Sure.
see, it goes to the higher ups. The higher ups is the adaptive immunity. Okay, you have specialized cells there. So then it realizes, okay, this person is someone coming from a different field. So then it develops, it mounts two type of responses called as a B lymphocytes and one T lymphocytes. B lymphocytes, we have antibody production. T lymphocytes are bigger cells that can go and engulf the bacteria or viruses together. So that is what we see. B lymphocytes, plasma cells, your antibody production. The antibodies fight against the organisms together. So we would have heard in COVID that even after infection, the antibody did not develop and all that. No, now it becomes very familiar to you. So this COVID vaccine, so the antibodies are produced. In some situations, what happened? You have the T cells coming in, wherein they go and attack the person by full in toto they attack. So that is what is the immune. There's the adaptive immunity. So we need this innate immunity takes about hours to develop. So immediate infection is there, but once they are not able to handle, then the infection goes into the body. Then sort of adaptive immunity takes some time to react. But once it goes to the higher up, we always know, no, when it is taken up to the higher ups, then the effect is much more severe. So it is called as adaptive immunity. Second time, when the same person is going to come into a new field, already the soldiers are aware that such a things have happened, so they mount the immunity much faster. So the adaptive immunity becomes much faster during the second time of infection. So right now, what does this have a connection to our vaccination, and why am I telling you about this? So here what happens is, in case of infection by a normal time, first time you get infected, your innate immunity fought against that infection, and then it has already triggered your adaptive immunity, right? So it will trigger your adaptive immunity, and the antibodies and T cells are already sensitized. So I get a viral infection today as a small child, I get a chicken pox or something. After 5 years or so, or 7 years or so, I again get a chicken pox. That time, my body knows that this is a person who has already attacked us. So it will mount a response that the chicken pox completely does not produce any problem to me. So first time my infection would have been very severe, but subsequent times the infections will not be that severe, or I might not even catch the infection. In vaccination, what happens here in this one, the vaccination forms the initial response. It is like the initial infection. But what we have done in vaccination, we are using the same organisms, but we have taken away the component that produces a lot of side effects. Say for sometimes I get the chickenpox in the first time, I will be developing the fever, very bad rash, and all those issues, right? So when I get the first time infection, this vaccination, when I use the organism for the vaccination, I will not get the side effects, but I will trigger my immunity and keep it ready, so that when the real organisms comes and attacks me, my body is already sensitized to the organism, so that I am mounting a response. So that is what we mean it as an adaptive immunity. So this is what is a immunity, innate immunity, and adaptive immunity we talked about. Vaccination actually is the first step for the adaptive immunity. So I develop antibodies, or my T cells is sensitized, so that when the person comes and attacks in reality, when they come with problems, my body reacts in a very big way. So this is the second slide. If you go, as I said, adaptive immunity is called as the humoral and the cellular immunity. Humoral immunity is nothing but production of the antibodies. In cell-mediated immunities, they attack in whole, and sometimes this will interact with each other. In case of a corona, where you have both humoral immunity and cellular immunity acting upon, it acts together. Then simply to put about, if you don't have this sort of a mounting, you become immunodeficient. In HIV, in AIDS for that matter, why people die? Because they are not able to mount. Even a small diarrhea can produce a severe problem. In a newborn baby, the skin is not very soft, okay, so it gets easily infected. That is why we are very worried about the newborn babies. But as we go, when we get exposed to a natural infections a lot, we develop the immunity here. So in the next slide, if you see, that is what we call it as active immunity and a passive immunity. Active is I get a natural infection. Okay, I get chickenpox, I get cold, I get flu. Then my body is already having the immune response, that is called as a natural immunity. In some
Right.
situations, when it is a life-threatening disease, like if I catch measles, or if I catch diphtheria for the first time, that it is a life-threatening disease. I can't afford to have a second time, because in this time itself, I don't know whether I will survive. Say for COVID vaccine, COVID disease, right? So in that time, we are giving an artificial immunity through the same method, where we have taken away the harmful part of the organisms, but we have used the part which is capable of inducing my immunity. Sometimes what is this passive immunity? Passive immunity is somebody has already produced the antibody and kept it, and I am getting it because I am sick now. And the newborn baby is not having any antibody. So the mother is actually feeding. As I am 20, 25 years, I have been exposed to all the infection. So my body will have some natural antibodies in my system. So that will come out in the breast milk, and I will be giving it to my baby. So my baby will require the antibody from me, and it will have that initial 6 months or so, it will help us to fight against infections. So, for example, the baby is not able to mount against the virus. It cannot fight against the measles. It cannot fight against chickenpox. But the maternal antibody will help. That is exactly the reasons we tell, please give breast milk, because breast milk is not only the nutrition content, it has so much amount of antibodies, so that it will help you to protect your newborn by up to about the time when the newborn himself or herself can handle the world. The other thing is an artificial antibody, where we have prepared antibodies in the lab, and we know this person is so weak that he's not able to mount a response in his body. So we give it from the outside. That is what, plasma therapy, which was most talked about in COVID vaccination, COVID treatment. Plasma therapy is nothing but we took the plasma of people who are already infected with COVID and who had antibodies, and we gave them. So this is what is the passive immunity. So here in
Understood.
vaccination, yeah, you understood it clearly, right? So here
Right.
what we are talking about active immunity is, I am going to give the artificial infection to the baby to an extent that it does not harm, but to an extent that the baby can mount an immune response. So that is what is the basis of your vaccination. Okay, now
Right. Yeah, that's gave us a lot of clarity. And for those of you who have just joined us, we are with Senior Pediatrician Dr. Narmada Ashok, who is educating us and answering all our queries on important vaccines for newborns, which you should not miss. Today's live is part of the Parentium Plus membership program, where we will be curating specific support to help parents. In this newly launched Parentune Plus program, you can expect focused expert interactions, consultations, and workshops. You can avail of all of this with the Parentune Plus membership, now available at an inaugural offer of only rupees 499 for the whole year. Dr. Narmada Ashok, coming back to something you said, you spoke about how there are some life-threatening diseases wherein we cannot wait to develop and then develop natural antibodies towards, and that's why we need vaccines for those. So when it comes to newborns, what are those mandatory vaccines that could threaten their life and that vaccines have been made mandatory for?
Okay, so before we really go into the vaccine, I just want to talk about a little about how the vaccination actually works, because we are into the thing, and then we will go to the
Understood.
mandatory vaccination. Okay, because we
Perfect.
have already started on the types of vaccination, and then I'll go to the thing, because once I start off with the individual vaccines, even to understand what the individual vaccines are there, you should have a basic knowledge of this. Then we'll come back to that. Okay,
Sure,
so if
sure,
you
sure.
take the thing into, as I told you, the vaccination is nothing but the modified the organisms which we are giving. Suppose if you are having a group of children and then you have vaccinated few of them, and those children who have not been vaccinated, this is with regard to your first question. What happens if they're
Yes.
not getting vaccinated, right? So the person who is not vaccinated will be more vulnerable, and he will get the live virus or the bacteria in a very virulent form. So that is the reason this is what we call it as a herd immunity. Herd
Right.
immunity, when we have already immunized a certain percentage, the number of sick children is going to come down. So this is something that is why we are targeting even for COVID vaccination, not to vaccinate everybody. Herd immunity is certain percentage in the community have already been vaccinated. Then the chances of them infecting the other will actually come down. In the case that herd immunity is low, or the enough number of children are not vaccinated, those who have not been vaccinated will be infected with a very virulent organism. So coming to the next slide, if you see one, the microbe, no, the microbe is actually, if you see, you need to understand that why different vaccination, and also understand why we have been advanced in COVID vaccination here. So here, if you see, the organism can be a virus or the bacteria. In case of when it is given as a whole, when the organism enters as a whole, certain part of it will produce the immunity, they will give fever and all that. Certain part of it will trigger our antibody system, and certain part of it will just not be any use at all. It will be a dead part. Doesn't produce any problem. So what we do, when we are giving a virus vaccine, we can have two part of it. We will take a virus or a bacteria, remove the harmful component of it alone, and then give the whatever it is, that is what we call it as a live attenuated. For example, in case of a tuberculosis, the bacteria is very virulent in the first generation. Then we start multiplying them by numerous techniques in the second, third, or 22nd generation. When it comes to the 22nd generation, the bacteria is capable of enhancing your immunity, but it does not produce any harmful effects into your body. So those vaccines are called as a live attenuated vaccines. In sometimes this cannot be done. So what do? We kill the organisms completely. That is called as the whole cell but inactivated, or it's a dead vaccine. Completely it is dead, but the dead protein is capable of sensitizing your body to the immune system. Sometimes we don't want to take that risk with giving the whole bacteria or whole virus. Then, because of the advances in scientific thing, we have found out that that is one part of it which is capable. One particular protein of it is capable of inducing immunity. We take out that alone, tag it with a non-virulent organisms and give it. So that is what we call it as a recombinant vaccines, or all these stuffs which is coming about. Why we should know it is Covaxin. Why I'm using this COVID virus vaccinations. Now you will be very familiar. We have two vaccination. One is the Covishield and Covaxin, right? Covaxin is the attenuated. It is actually the inactivated one completely. Whereas
Okay.
Covaxin, so that is why, and it has been that is why we feel the immune response will be the same in both, but there is no live virus here. Whereas here, in case of the Covishield, what they've done is they've taken one part, tagged it along with another virus, with adenovirus component, spike component, and made it as a recombinant thing. So that the virus is still little active. So that is exactly there is difference between it. But with regard to the immune response, both of it are the same. But with regard to the side effects, they claim that Covaxin has got a less amount of side effects because that has been completely an attenuated. It is a killed vaccine there. So that is why I need to talk about this one, because this correlates directly with your the side effects which comes with the vaccination. Next.
Okay.
Next slide. Yeah, you understand. That is the reason I wanted to spend a little time on this slide. Yeah.
Yeah.
So how do vaccines work? As I told, the killed vaccines will go to the lymph node, and then from there, predominantly B cells will be stimulated. What is the advantage of live vaccine? They are still live into the body, right? So it goes a little further, and it can activate multiple lymph nodes. So, for example, one thief comes to the front entrance alone. That person is alone stimulated there, so they only know about the problem. Whereas here, one group of people are and it is attacking. So all the sentries know that the problem is happening. So the immune response is mounted is much bigger. So that is what is the advantage of using a live vaccine. In the killed vaccine, the vaccine's immunity might not be that much, but only thing is side effects is very less. If there is the disturbance to the body is very less, but the immunity might not be sustained. So that is the difference between killed and the live vaccine. Next.
Right. Right.
So if we come to our vaccines, if you see, it also depends on the type how we are giving, because response is also determined by the oral. Oral route, if you give, it is usually by attenuated virus. So that is capable of multiplying. So oral polio and rotaviral, it is capable of multiplying. As well as intramuscular route, as intramuscular is giving it by deep IM. That is, the absorption is way different from that of a subcutaneous vaccine. So it all depends upon what is the type of vaccines we have used, what part of it is being used, and what is the conjugate and recombinant. That is why they are claiming even if the latest coronavirus affects us, we will be able to produce the vaccine because they take the attenuated form. They are able to they are able to prepare the vaccine in the recombinant form very immediately, whatever the protein comes, because the protein they are going to tag it along with some other virus and give it to us as the vaccination. So that is why in the corona vaccine they literally have been able to produce the vaccines very sooner. So something similar to that only. And then the response, you have oral vaccines, intramuscular, intradermal. We will go about when we are discussing with the individual vaccines. Now coming to your question of what are the important vaccines. So now only why I touched upon is, let us complete the basics of vaccines, then we will go to the important vaccines that come into play. In that, if you see, there is two schedules. Okay, one is the schedule by the government, that is the National Immunization Schedule, or it was called as UIP. Okay, in 1975, when they started off, that is the time when India started vaccinating its citizens for free of cost as a part of the procedure. Next slide. As a part of the eradication for the smallpox, we also contributed, as well as that was the time when we started Universal Immunization Program for children. In the Universal Immunization Program, again was launched in 1985, and then it became a part of the Child Survival and that's called a CSSM program. CSM program 1992, and the biggest shift came in the National Rural Health Mission. Why am I telling all this? As a citizen, we have to know where our healthcare budgeting is going, and then who and all are influencing it. WHO has influences most of this protocol, and sometimes we get support from the outside voluntary organization. We all know Bill Gates, right? Bill Gates is not only he's a pioneer in the field of the software. He is also his Melinda and Bill Gates Foundation have done a lot in vaccination. They have invested. They have also contributed. So they get what is available. If suppose 2 rupees is the vaccination with the Melinda Gates Foundation, you can get it for about zero 0.5, whereas India will be spending about only zero 0.5 paise for the vaccine, when it will be supported by the Gates Foundation for the rest of it, so that the vaccination can be given. We are talking about millions of children. Okay, so even a zero 0.5 paise difference is going to make a huge dent in our health budget. But in spite of that, the NRHM, after the NRHM came, and recently for the past 2 years, the government has introduced two new vaccines. For about 20 years, we were having only 6 vaccines into it. But now, after the government has taken over, they have introduced two more vaccination, which is very, very important. How is the vaccination determined in the public health? It is with the public health perspective of bringing down the mortality in under 5 children. Why do you call America as a developed? And though we are all working equivalent to US and we have a brain and mind equivalent to US, why do we call it as a developing nation? Do you know why, Jarna? I don't want to be
Because is it because of the infant mortality rate or the maternal mortality rate?
Yeah, yeah, I know. Thank you. You are really aware of it. People think that only the economy of the people matters. Actually, we call it as a developed and developing nation, not by the economy, per capita income at all. We actually tell it based on you're very clear on the under 5 mortality, especially, and on the maternal mortality rate, as well as all on the lifespan, life expectancy, and all that water, availability of water for every individual, availability of toilets, all those. But with our regard to our workshop, what is very important is our under 5 mortality. Under 5 mortality and maternal mortality. So under 5 mortality, there are major killer diseases that contributes to the under 5. So we actually assess what are the killer diseases that are contribute. So government of India takes those killer diseases as a priority, and if vaccination are available for them, they try to give it. So if you see in universal immunization schedule, what is our killer diseases is that oral polio. Polio is, as I already discussed to you, it has got a higher amount of mortality as well as morbidity. So the productivity of every citizen is going down, not only the death rate. So polio was included, and the polio is very, very effective vaccination. So they have taken that into consideration. So they don't take it because some manufacturer asks them to take it. That is not the reason they decide. They decide based on the mortality status. The other thing is your diphtheria, the tuberculosis. TB, we know we are the leading people who are contributing to childhood tuberculosis exactly, especially. So tuberculosis is that is your first vaccination which you get. Your BCG will discuss individual. The other thing is your diphtheria. Diphtheria is nothing but, I don't know what you call it, is like continuous cough which comes for the child. They get big infections here, and the airway is completely stopped and leads to death of the child. That is diphtheria. Pertussis is child coughs continuously, and because of the continuous cough goes for a complete apnea and death. And tetanus is nothing but that comes in the newborn period where you get convulsions and all your muscles goes into tight contraction, and eventually because of that respiratory arrest comes and baby dies. So this was and the other thing is your measles. Measles, it is nothing but a mata. It comes like a mata. But what happens is measles reduces the already immune status of the child. And in our nation, where the nutrition is also very low, it further causes pneumonia for the child as well as diarrhea. The killer diseases for us was pneumonia and diarrhea. So measles actually contributes. Then these are the things that has been taken into consideration. They found out that hepatitis B, one thing is against jaundice, that produces liver cancers and liver mortality in plenty of children. So that was included. Then the other thing is people die due to brain fever. Brain fever is something we are very, very much worried about, right? So we are really worried about when what you call as dimag ka bukar. So dimag ka bukar, actually two major organisms are H influenza B and pneumococcal. So they took that into consideration. So all this was given. So nearly 8 diseases they covered into this thing itself. Then last 2 years they found out that, again, as I told you, the under 5 mortality is very much with your pneumonia and your diarrheal diseases. Pneumonia is sardi zukam, and that affects your lungs, and child dies because of difficulty in breathing. And there is diarrheal deaths. Diarrheal, and we have the diarrheal under 5 mortality is that is, if you take 100 babies who died before under 5 of their age, 70 percentage of them would have died either due to a pneumonia problem or due to a diarrheal problem. The rest of the 30% is due to some other problems. So we are concentrating on those diseases that have contributed to the mortality. That is why pneumococcal and diarrheal, the diarrheal diseases have come into the thing. So that is what we told you for the when you look at it, pneumococcal vaccination was introduced in the last 2 years, and the diarrheal vaccine, rotavirus, is also introduced. So these are absolute important vaccine which is uniformly necessary for all children, irrespective of whether they are born in a slum or whether they are born in a very poor family or whether they are born in an affluent family. Every
Right.
child born in India should be entitled to get these vaccines. These are all important vaccines.
Right. I hope you've taken note of all those mandatory vaccines that your baby should be given in their initial years. And don't worry, you will also have access to the recorded version of today's workshop for your reference at any point of time. So you can go back and listen into this discussion once again and make note of all the mandatory vaccines that you must ensure that your child is given in their initial years. You can also go back and listen to the lovely detailed explanation Dr. Narmada gave of how vaccines work, and of course, their benefits initially, and the science behind vaccines and how they create an immune response in our bodies. Doctor, you've mentioned the mandatory vaccines for babies and young children. Could you take us through exactly when these need to be administered?
So here I would write a little tell about the vaccination schedule which has been shown by the Indian Academy of Pediatrics. So this is basically for those children who are able to spare some amount of money, whose parents are able to spare money, right? So can go to a private practitioner and get it done. The vaccination which I already told about was the government gives it free of cost for
Okay.
everybody. So here in the private sector, there are certain diseases which have vaccines, and I would like to protect my child against it, right? Like for example, corona vaccine is available both in the government sector as well as in the private. In private, I pay some amount of money. And here I am having certain very good vaccines that my child can further be protected. So that is what we call it as a vaccines, which is for the individualized or a private practice. So it is not that whether these vaccines are very important vaccine and these vaccine is optional. No, these vaccines are those for people who are able to afford it. Okay, why it is so is because the health budget spends so much on vaccination, and as I told you, millions and millions of children are available in India to get it. So it is not possible for all the vaccines to be given to all children. For example, is that chickenpox vaccine, which is very important. That is a Mata, that is very important for all the child. And there is a Japanese encephalitis vaccine which is available, or a meningococcal vaccine, that the cost rate is very much higher. So this cannot be given for all the children, but the option is available for the parents, at least who are able to afford to go and get it. So these are the vaccination. And Indian Academy of Pediatrics looks at all the children. Like it looks at children who are not able to afford and who are able to afford also, and has given a uniform schedule, whereas Government of India sticks to those schedule that is given free of cost to them. So we will go to back to the timetable here. So if you see the starting at the birth, that is as soon as the child is born, what we give is 3 vaccines. That is, this we insist that the child is given even before the child leaves the hospital. Only in
Okay.
very special circumstances, these vaccines are given later. Otherwise, all the children born in a facility or even if are born in the home should be given the vaccines. These are the BCG. As I told you, BCG is Bacillus calmette-guerin, which is the tuberculosis. This is a live attenuated form of a tubercle bacteria, tuberculosis, so that we are protected against the tuberculosis. So why I said protected and not eliminate tuberculosis, because the BCG, Bacillus calmette-guerin, the BCG vaccines gives protection mainly for the brain tuberculosis, mainly for the brain tuberculosis. It definitely brings down the infectivity, severity of the infection, but it does not completely eliminate it. But you are very much protected, and it is one of a very powerful vaccine. So and the immunity stays lifelong. Here we are giving a live attenuated vaccine, so that is called as a BCG vaccine. Why I'm saying is live attenuated, as soon as you give the vaccine, some of the children will develop small swelling near the hand, and even this can become big. Usually it is given at birth, but the effect is all seen after 45 days or 6 months after the schedule. So it really acts in the local lymph nodes and then spreads to the whole body over the whole year. So the BCG vaccine is the one that is given at birth. The
Right.
second is the hepatitis B vaccine. As I told you, the hepatitis B vaccines, hepatitis B is a jaundice. There are 5 types of jaundice. The jaundice is hepatitis A, which is spread through water. Jaundice is nothing but, you all know about the jaundice. What do you tell in Hindi, Jarna? I'm not, we call it as manchal kamala in Tamil. So it is a kind of disorder that affects your liver. Okay, so it's an infection that's capable of infecting your liver. So in hepatitis, there are two. One type of jaundice is your hepatitis B. The predominant mode of spread is through your blood and blood products. So this is a little severe than hepatitis A that is spread through water, because it is capable of producing liver cancer in any person who's getting it. And liver damage or chronic liver damage, it's very much severe with your hepatitis B. So that is why we give the vaccination. And one thing is, if you're all pregnant, there are pregnant mothers who would be listening to us. They would know
Right.
that hepatitis B, HBsAg is scrutinized at the time. HIV and HBsAg, we scrutinize you while you are pregnant. Why? Because you might not be having any of the manifestations. See that the jaundice takes about 10 years for it to, or 10 or 5 to 10 years for it to infect the liver. So you might be asymptomatic now. You do not know that you are harboring the infection in your body now, but you might transmit it unknowingly to your child. So that is the reason we screen you for it. And an eventuality that even the screening has missed, if you give the vaccination within 72 hours, the child will be protected. So that is what it is, the hepatitis B vaccination. So, and the third one is your oral polio vaccine. So we all discussed about the oral polio virus. A polio virus is capable of affecting your neurological system, especially your peripheral nerves. So it can cause paralysis of your legs or paralysis of your whole your body. So that is what is the there's a very deadly disease. Polio virus is a very deadly disease. So we give oral polio vaccine. So here, when I come to about oral polio vaccination. Now in the market there are two vaccines available. One is your oral polio vaccination. The other is your injectable polio vaccines. So as I told you, the immunity is also determined by the mode of administration. In case of oral polio vaccines, we were using the live attenuated vaccine, where the polio is capable of multiplying in their body because you give a live attenuated form. Whereas when you're using injectable, we use the killed form. Okay, but the killed form had about 98% sensitivity and specificity, and oral polio vaccine was actually given to the oral baby, and then it had to multiply in the gut of the babies. Okay, this means in your abdomen it has to multiply. Now, because India being a lot of organisms were there already in our stomach, so this was interfering with the multiplication of the polio vaccine. So our sensitivity, and that is the percentage of our antibody response was noted to be very less, only to 50 to 60%. So they decided that multiple times the oral polio vaccine has to be given. That is why, if you would have seen, even before 3 years, we were giving it multiple times, 5 or 7 times we were giving the oral polio vaccine. What happened is, then actually it was found out that injectable vaccine was another type. The beauty of it is both of the vaccines were found at the same time, Salk vaccine and Sabin vaccine. And actually, India had the opportunity to use injectable to manufacture injectable polio vaccine, But at that point of time, due to the governmental policies, they took more in favor of oral polio vaccine, and injectable polio vaccine was not given, was not taken, and we did not take up the manufacturing thing. The difference in between oral polio and injectable polio is I told you the percentage. One more thing is oral polio vaccine has got now only two, type 1 and type 3 only, whereas injectable polio vaccine has type 1, type 2, type 3, three of the conjugates. In corona vaccine, we are hearing numerous different strains of viruses are coming. Polio has also got three strains: type 1, type 2, type 3. Injectable polio has got three strains, and the oral polio has only two strains. Why this difference is till we eliminated from the polio completely from India, we were using three strains from the oral polio only. But once we got it, we eliminated it. What happens is if we are giving the organism live vaccine itself continuously, when there is no threat of the wild virus at all, then this virus which is being given as a vaccine itself can mutate. By
Okay.
nature it can mutate. Okay, so when it mutates in nature, what it can produce is it can cause paralysis. It
Okay.
gets a very rare possibility, like 1 in 10 lakhs or 20 lakhs, but it is a possibility. Okay? So that is why we want to switch over from the oral polio vaccine to the injectable polio vaccine. We want to go from the live thing to the killed as soon as possible. But that could not be done immediately because of the huge demand of the huge population we have. So what they did, they found out that type 2 vaccine, we have not been infected for a very long period. So they took the type 2 and they gave only type 1 and type 3 alone, because type 2 had got a severe percentage of converting itself to a vaccine related poliomyelitis. So they said, okay, let us not give our children type 2, we'll give only type 1 and type 3. So what happens is now my baby has got type 1 and type 3, but it is not still protected against the type 2. Okay. Where is this comes as a problem? This is where again politics plays a play. It is very interesting, Jarna. It is not only a simple vaccination. You should know how it really works. Because of the Afghanistan, we have a lot of terrorist group organization. They thought that the Western countries are introducing the vaccination in order to reduce their fertility component. So they
Okay.
are not introducing vaccination at all into their place.
I see.
India, as such, was very challenging for them also, because we have somewhere from Jammu and Kashmir till Kanyakumari, we had a lot of society, different people. But and then WHO for them, India was a challenge. They said if India could eradicate polio, then it will not be a wonder that the world eradicates polio in no time. And we exactly showed to them because of the dedication. I should appreciate every worker, healthcare worker who went to the nook and corner in the terrorist-ridden places also and deserts in the hills to vaccinate every child. So polio was eliminated. But here what it is, whenever the healthcare workers goes to the places of Afghanistan and Pakistan, they are not able to vaccinate the children. So there the type 2 has become endemic. And Pakistan are our neighbors, they are very close to us. So there might be some chance that the type 2 migrates from Afghanistan and Pakistan and comes into India. So
Right.
that is why injectable polio has to be given to every child. So now the government, what happens is 2 months, 3 months, and that 4 months the schedule, they have introduced injectable polio in combination with other vaccines. But sometimes in some states, the injectable polios are not given. In that case, it is definitely necessary for you to go to the private practitioner and get the injectable polio. One. And the other point is, you have heard something of oral polio vaccine being given at one particular, on January, on one particular day. We call it
Pulse
as the
polio.
pulse polio immunization. Okay.
Right.
Interestingly, this pulse polio concept started with my place, Vellore. We
Oh,
have a
okay.
very famous microbiologist and a leading person in from CMC called as Dr. Jacob John. He has done a lot and lot of studies in this, and he found out that children in our slum area or nearby in Vellore, Satnambid, the infectivity rate was very less. That is when they were the antibody production rate was very less when they were given oral polio vaccine. So he said, in order to mount the response, around 5 or 7 times the child has to be vaccinated. He was the one
Right.
person he found out. Then he found out that when all the children are given at the same point of time, This is a live vaccine which multiplies in the gut. So on the same day, if I give for all the vaccination, the vaccine, the virus will multiply in the gut and it will come into our gutters. So when it comes into the gutters, the wild virus is totally eliminated from the thing. So
So
that
is
is
this,
why
I'm going to interrupt you, doctor. Is this the reason why the children who have had injectable polio also have to take the oral pulse polio
yes,
drop?
exactly, exactly.
Okay.
Injectable polio is for the personal protection of myself. Whereas when I give the oral polio vaccine, I increase the herd immunity of the population, as well as when the virus is going to come into all my gutters, my wild virus is going to go away. So I
Okay.
will be doing it till the virus is completely taken away from the world. And also, because I've already given my child the injectable polio vaccine, the problem with this vaccine associated polio is also not there with my child. So I can safely give oral polio vaccine, but because I've already given injectable polio vaccine. Right, so
Right.
this is it.
Right.
So coming to the schedule, so this is what it is. The key updates is hepatitis B vaccination, which has to be given within 24 hours of the birth, and then you go with oral polio vaccines. And I think we have discussed in detail about what is the difference between OPV and IPV. Then next we come to the vaccination which is given at 6, 10, and 14 weeks. So 6 weeks we give the same vaccine is given at 6 weeks, 10 weeks and 14 weeks. So here we come about, here is all along I was talking about individual vaccines. Sometimes we can combine vaccines so that the immunity is actually enhanced. The child gets less number of shots and the side effects is also less. So I don't want to prick my child. I have already spoken about 10 vaccines and I want to give the six for the protection against six diseases at the same time. I cannot be pricking my child six times, right? Which mother will allow? I will not be ready to prick six times for a baby, right? So I'm trying to do the combination vaccine. So that is the advantage of combination is with a single shot, I am protecting against so many diseases. The first combination vaccine, which was very successful, is your diphtheria, pertussis, and tetanus combined together. Diphtheria, as I told you, is that infection that comes to the respiratory tract. It produces big swelling in the neck. Sometimes it goes into your body, affects your heart, it can affect your nervous system, and it can cause death of the child. Pertussis is a continuous cough to the point that the child collapses with coughing and dies. The third is your tetanus. So we have combined these three vaccines, diphtheria, pertussis, and tetanus. So that is combined. Now I also know that polio vaccine, if I combine with it, that does not create any difference in the antibody response. So I combined polio also along with it. Then I found out my hepatitis B alone is standing separately. Can I combine that? Then we conducted studies and we combined the hepatitis B. Now, then we found out that the meningitis, brain fever is one of the biggest problem. Could we combine it? Yes, it was possible. We combined. So that is a combination vaccine where DTWP, that is diphtheria, pertussis, tetanus, along with polio vaccine, hepatitis B, and Hib is covered. We have 6 diseases against which a single vaccination or the combination vaccine is available. So that is what is given at 6 weeks, 10 weeks, and 14 weeks. Now, can I talk about, do you about diphtheria in detail? This comes a very important question of your repeatedly people ask me about pain vaccine and painless vaccine. Can I discuss it here or we'll discuss it
Yes,
later?
doctor, in fact, I was also going to ask you about, there is a lot of misunderstanding and myths related to
Mm.
this concept of painful and painless vaccinations. So if you could, throw some light on whether painless vaccinations actually exist. I actually know that, it's available in case of DTP, but if you could throw some more light on
Yeah,
that.
because I wanted to touch with this because the concept of pain vaccine and painless vaccine comes only with relation to your DTP vaccines, nothing else. Basically, all vaccines are capable of producing some amount of side effects, but the side
Okay.
effects, to what degree the side effects is and to what degree it is acceptable is our problem. Okay, so what we did when we found that diphtheria, tetanus, and pertussis, diphtheria, as I told you, we are using the toxoid because the bacteria enters into the body and to produce problems in our body, it produces some toxin. That is, the bacteria does not do anything. It is having some chemicals which it uses and it then affects the organ us. Okay, so that is called as a toxins. So what we did, we found out that the toxin was a major reason for producing problem. So we converted the thing into a toxoid so that it will induce immunity but not produce any complication. So diphtheria was a toxoid. Tetanus was a toxoid, where we have not used the organisms at all. We have used their chemicals, which is capable of producing problems. Chemicals, I mean a lay term, but actually it is not like that. It is a scientific term, is a toxoid, which we are using. The other comes to the pertussis. Pertussis, as I told you, the bacteria as a whole, if you are using only it, we were able to mount a response. So we actually killed the bacteria and gave it so that it was able to mount the response. Then we found out even when the bacteria was killed, the protein surrounding the bacteria was producing so much of an issue that the child was getting fever a lot. The child was vomit. Sometimes were not able to move the legs at all for 2 or 3 days, right? It was very severe swelling, or the child was crying continuously, and in very very severe cases, very rare cases, child also had a convulsions. So what we did, we found out what was the component that was producing the problem. I mean, we matlab, the people who are doing research found out what was the component that was producing all these complications. Then they found out that the particular giving the bacteria as a whole was producing problem. Then they researched and found out what is the protein component that alone is enough to capable of mounting the immune response, which we have already spoken about. No, when that is why I discussed in detail about how the immune system is stimulated. So in the immune system stimulation, the protein component alone is capable of stimulating the immune system. Then we took out that protein alone. We removed the cell of the pertussis. We killed the bacteria, removed the cell, and we gave that protein component which is capable of mounting the immune response alone. So that is what is called as a painless vaccine, which is called acellular pertussis. So painful vaccine is nothing but it has got the whole cell vaccine of the pertussis. Like, and the painless vaccine is nothing but acellular pertussis that doesn't have the whole cell component. Okay, coming to the concept of why am I worried whether it is a whole cell or a acellular? Why should I really, right? You'll be worried. So some people, if say for your in-laws or your mother will say, at that time when I used to give you, you used to get good pain. That is the best for this child. So don't give any painless vaccine now. It will not have any response. So let me tell you, the immune response was equally good with both painful and painless. But then
Okay.
there was one problem in the US. They have been using painless vaccine. There is, the Western world always want to bring out, bring more comfort. So they were only researching on this, and they were giving painless vaccine. They found out that children by about 12 or 20, 12 years, no, started developing again this pertussis. They started developing this pertussis. So they were
Oh,
wondering why are they getting it? Then they found out their immunity. Now today I give them at 10 years. We always see three things with vaccination. One, how easy, how effective it is. Okay, how less the side effects are, and third thing, with this effectiveness and with this amount of less side effects, how long the immunity stays. See, I
right.
give my vaccination now, right? I should be able to protect it lifelong. I don't expect to get an infection again in the adult. Then there is no point in vaccinating, right? So, but by benefit of my age, I might develop some immunity. But till I develop that immunity by myself, I should have the protection. Then they found out probably the acellular pertussis, the immunity is not sustained so long. So what do I do? Whether should I switch back to wholesale pertussis? If I did that, then there was a problem of this fever being high, or I get this. So
Yeah.
then they passed a protocol that whomever was given acellular pertussis vaccination in their childhood, make sure that you continue acellular pertussis at 5 years, 10 years, and 15 years also.
Oh,
Okay,
okay.
and then now they also found out there was adult-induced adult pertussis also. Then there was the TT, the maternal tetanus incidence was very high. So babies were affected with tetanus. So we all know you are getting one shot of tetanus while you are getting, if you remember in your 7 years, you would have got your tetanus vaccine at 6th month, at 7th month. Now we are no more giving only tetanus. We are giving a component of the diphtheria. We are also giving component of acellular pertussis as well as tetanus. DTAP, we Tdap. It is called as a Tdap. That is, tetanus is the bigger component. Diphtheria and pertussis is a smaller component. So no pregnant ladies is receiving single tetanus alone. We are giving the combination of diphtheria, pertussis, and tetanus so that the immune system stays. So this is exactly the reason between use the painful vaccine has got the whole cell, but the immunity of it might stay longer. Painless vaccination also develops the same amount of immunity, but the only difference is it might go off, might wane off, it might not go off completely. It might come down. So, in order to boost the immunity, you are giving the injections again at 4 years, 5 years, and 10 years. So that is why we call it as a booster dose. So we have completed 6 weeks, 10 weeks, and 14 weeks schedule. In the 6 weeks, 10 and 14 weeks, we again have two more vaccines that was left out. One is your pneumococcal vaccines. As I
Right.
told you, brains will come, and then one of the other reasons for the baby to die was your under. If you see all those in yellow, that is at 6 weeks, 10 weeks, and 14 weeks are your vaccination. So what you see at 10, that is the pneumococcal vaccine is, they found out that the under 5 mortality was high due to pneumonia. Then they found out that two organisms were causing it. One is the H influenza. The H influenza also causes the brain fever that has been combined with the DTWP or DTAP and given as a combination vaccine, as a HIB vaccine. Then this pneumococcal is nothing but one more organism called as a strep pneumonia. See, these two are like, they will, when they attack directly, the problem is there. But one virus comes and sits, you get cold. On the first 2 days, it is only a tiredness, body fever, and then you start having some running nose and all. Some people will get better with this, and third or fourth day they will come to work. But still, some people will go on to develop a more severe fever later. They will start developing cough more, or the sputum becomes very thick and greenish. Okay, why? Because initially my infection was a viral infection. Super added to that, I got a bacterial infection. So they found out that strep pneumonia was such a bacteria that was capable of producing more mortality. So this is the same bacteria that was capable of producing mortality in flu vaccine, flu virus, and all that. So that they wanted to introduce. As I told you in the initial stages, that is in 2008, we had this vaccination. Similar to corona, it has got a multiple strains. Okay. Then initial vaccine which was introduced had 10 strains of the antibody against the 10 strains. So then there was the Gavi alliance at that time. Gavi was ready to introduce to us the Pneumo 10, but government of India was very skeptical because Gavi said, I will support you only for Gavi is nothing but the fund, the organization which is supported by Bill and Melinda Gates Foundation. So they were like, we will make you. Suppose they leave after 5 years, what will happen? So then India was a little hesitant in taking it. By the time the conjugates also, it was increased to Pneumo 13. That is 13 conjugates we had in the same vaccination. But it came at a very high cost of about 4,000 rupees for every one of them. So that was taken up only in the private practice. Now this government and they had negotiated, and with the alliance with WHO putting in, they wanted to reduce the vaccination, so they're giving this conjugate vaccine as in a much lesser rate. One more advantage that happened in 2020 is our own company, Serum Institute, also developed. We had only the international players in that, but then we had our own player who had his vaccination, and then we also had a lot of studies that happened in 10 years. The conjugates which were introduced in the vaccines, that is the strains which were introduced, were more from the Western world. But Christian Medical College, Vellore, and everybody contributed, very bigger institutions contributed in this multi-centric study. They found out what was the strains that was infecting in India, and the same strain was increased, and that vaccine now is available free of cost in 10 states. What is available as 4,000 rupees in the private practice is given free of cost for all children. Initially 10 states was included, now 14 states, and now in private practice we have been giving it for the past 10 or 14 years. With the introduction of the another vaccine, that is which is our own by Serum Institute, we have now, even that 4,000 rupees has come down to a much lesser rate of 2,800. So if more and more people are started vaccinating, the vaccination rate is still coming down. So that is the pneumococcal vaccine, which is the major vaccine that protects the children against not only cold, it protects against pneumonia, brain fever, and fourth more thing is it is also it reduces 70% or 17% of all cause mortality. If you give pneumonia vaccine, sometimes people will tell before here in Tamil Nadu, pneumonia vaccine is not available free of cost.
I
They
see.
selected certain states where pneumonia was high. They were not giving it to all states. So at that time, parents used to ask, Madam, why should I get 4,000 rupees? I said, for your birthday, for your baby, you spend 4,000 rupees for a dress. For a party, you spend, and you forget it on the day. But you spend 12,000 for this child, which is a protection for him for lifelong. Not only that, 17% of all cause mortality is brought down by the vaccination. So please vaccinate your child. I personally have seen children who get the complete schedule with the pneumonia. They come only for vaccination and not for any diseases. So that is one thing. The other thing is the
That's so,
rotavirus diarrhea
yeah,
deaths.
I think
We
that
have a
shows how important it is to give those optional vaccines also to
yes.
your
It's no
baby.
more optional. It is optional in the in the sense of your economy. The government is
Right.
not able to vaccinate, but it is trying. It is definitely trying, and that is why we as citizens have to ask, or we instead of having war, no, investing in war and money, and we should invest more in vaccination because we are not fighting amongst ourselves. All we have become a global citizens. We are fighting against our common enemy is the viruses and bacteria. Look at this, no,
Right.
Corona has completely stopped the entire world. So the one common enemy for the entire world has been this virus. So instead
So
of
true.
investing in army, I mean, no doubt I have a very high regards for the army, and they are literally doing so much of work. But so many of our lives are lost in the army
Dependent on
because.
these vaccines. Yeah.
Yes.
Doctor, we're going to start taking in questions now. We have a question that's coming from Meenakshi. Meenakshi is the mother to a 6-month-old baby, and
Yeah.
Meenakshi wants to know, is there any need of any medicine after vaccinations? So, doctor, we've seen that babies at times do get fevers or other related symptoms. So,
Yeah.
should you as a parent be administering any medicine post all vaccinations, or should this be dependent upon the symptoms you observe?
Meenakshi, thank you for asking that wonderful question because initially everybody will think that they have to go and give the first dose of paracetamol actually. There are two thoughts with regard to that. As I told you, as soon as you give vaccination, your child develops some antibodies to it, right? So the antibodies are that has to be produced. So giving a paracetamol without the onset of fever can actually reduce the immune response. So you do not give it for all children. But for that reason, I cannot allow my child to have a fever, high grade fever, and keep yelling on the whole night. No, it will be exhausting. So you use paracetamol when it is discomfort to the child. So not as a routine, but when it comes as a discomfort for the child.
Right, Meenakshi, I hope that answered your question. We have another question, Dr. Narmada. This question's coming in from Bangalore, from Maya Burman. Maya says, "Hello, doctor. My baby is just 4 weeks old. Which vaccines are due for him this month? Also, he has a runny nose since yesterday. Is it okay to give vaccines or to have vaccines administered in this condition?" So for doctor, for such a young baby, should they be, or for any baby that matters, should vaccines be administered when they have a cold or a fever or any other such symptoms? And can those vaccines be postponed?
It's a very pertinent question, actually. We already discussed, we have actually come to 6, 10, and 14 week schedule. So she's saying her baby is around 4 weeks only.
4 weeks
And
old,
being
yes.
in a city, in a Bangalore, she would have had her delivery only in the hospital. So I'm sure that your hospital, your pediatrician would have ensured that your baby has already received BCG, OPV, and hepatitis B. So at this point of time, you still have 2 more weeks to go for your first vaccination with your DPT. So that is
Okay.
still there, one thing. Second thing, with regard to the cold, minor illness is not a contraindication for vaccination, especially
Okay.
the first 6, 10, and 14 week schedule. As I told you, I discussed in detail about not only the 6 diseases that is prevented, we also prevent against pneumonia. The rotavirus is also given at the same time. Rotavirus is a disease that prevents against your diarrheal illnesses and one of the major factors. So we want to prevent them early from all these diseases. So we only a running nose is not it's not at all a contraindication for giving the vaccination. But suppose your child has got a high grade fever, like say it's having a high grade fever or it is very sick, and I'm very sure your doctor himself or herself will not give the vaccination. So a minor illness is not a contraindication. However, your doctor is the authority to determine whether it can be vaccinated. Take your child to the doctor, let him examine. Whenever they come for the vaccination, no, I do something called as a well baby checkup. I completely analyze. One thing is the height, whether the child is according to the length of the child, whether the weight is growing normally, whether it is picked up from before, as well as I also look at the development assessment of the child, how it is at 6 weeks. We already had a workshop where we were looking at the milestones of development, right? So I will also ensure that each vaccination visit for me is my time to interact with the baby to know whether it is developmentally normal. I do all that, then I decide whether to vaccinate. So your doctor will definitely do all that and ensure that Even at the time of the vaccination, there is no major problem. But for your clearance, like even if the child is having a mild cold, it is not a contraindication for vaccination.
Right, Maya. So I hope it answers your question. You can wait like Doctor mentioned, the next vaccine due for your baby will be at 6 weeks. So we hope his symptoms will be over by then. And even in that case, a mild cold will not cause any problem with the vaccination. Dr. Narmada also made reference to a workshop we had done previously on Parentune with regards to developmental milestones. If you'd like to have a look at that, the video for that workshop, you can subscribe to the Parentune Plus program, where you will have access to all Parentune Plus lives as well as the workshops and lots of value added benefits. You can subscribe to the Parentune Plus program with an annual membership that's now available at just rupees 499 for the whole year. Dr. Narmada, you also mentioned rotavirus. So our next question, in fact, is related to the rotavirus vaccine. This question is coming in from Ahmedabad, from Renu Raman Pasricha. Renu says, "Hello, doctor. My daughter is 11 weeks old. We missed the rotavirus vaccine second dose. Should we get it done now, or should we skip this one? Would one dose be enough for her? Is this vaccine mandatory here in India?"
Yeah. So rotavirus, we are vaccinating against the virus that is capable of producing the diarrhea. Diarrhea is caused by a lot of organisms, but the predominant one is the rotavirus, and that is also causing severe dehydration. When the child gets a rotaviral, the child has severe watery diarrhea and goes for loss of fluid. The diarrhea does not kill, but the loss of fluid kills the baby immediately. That is why dehydration is very, very significant and very important for us. So the rotavirus is some diarrheal, it actually prevents. Here, if you look at it, what is the importance of rotaviral vaccination is, it prevents severe severe virus-induced diarrheal deaths actually. In rotavirus, you have a spectrum. Some children will have mild disease, some children will have moderate and severe disease. So actually, rotavirus vaccination is capable of protecting your child against the hospitalization and the severity of dehydration. So with rotavirus being very much here, you have to give your child in order to protect it. In India, yes, definitely it is very common. It is not a Western disease at all. It is very much available in India. And coming to the vaccination schedule you were talking, there are actually five different types of rotavirus vaccine produced by five different type of company. There is only one vaccine that's called as a monovalent rotaviral vaccine that comes from a company called GSK Rotavirus. Actually, you have to have only 2 doses, 6 weeks and 14 weeks. Whereas the rest of the companies and all, one company has taken our own rotavirus from the children who are normal. They have taken the stool sample, they have taken the virus from that and made this vaccination. So like that, all the 5 vaccines are equally effective and protective. So that vaccine, that all the other vaccines have the schedule from 6, 10 and 14 weeks schedule. So you have to give the 3 vaccines. Why? Because again, if you had been hearing to my lecture on the oral polio vaccine, this is an oral polio vaccine, right? It's a oral, when we are giving it, the same thing as rotavirus, oral rotaviral vaccine. When I give it into the body, it has to multiply in the gut. Sometimes the local organisms are there that is not allowing this virus to multiply. So at that time, my immunity level will not be so much. So that is why I'm giving, if you see the injectables are giving all these live vaccines and all, we give only 1 dose or a booster dose. Whereas the attenuated one, which is a killed one or a conjugate with one, we give multiple booster doses. So for rotaviral vaccine, as we don't know whether the subsequent doses, whether the first dose was effective, we are giving actually 3 doses. So your doctor has already given it the 6 weeks. You have missed it at 10 weeks. No problem at all. You can take it at the 14 weeks. And then that is when you're going for the next schedule. That is, you're almost due for your next schedule in another 3 weeks. So you can give it along with that and then complete your schedule again 1 month later. The earliest vaccine or rotaviral vaccination has to be taken is at 6 weeks, and the latest which it can be taken is up to 8 months. That is, at 8 months, the first dose has actually ideally to be started. Why this timeline is, there are certain group of children who develop something called as some abdominal problem. It's called as an intussusception because of that. So we want to vaccinate the children within this safety net of 6 weeks to 8 months duration. So that is why we have to do. Missing your vaccination schedule, no problem. When you go to the next visit, because it is a live vaccine, that is one again. Whenever you give one vaccination now, I want the next vaccination to be at a gap of about 28 days. I don't want to give it immediately because my body has to develop an immune system against it. No, immune system has to recognize. So here in the rotaviral vaccine, it is a live vaccine. So I want to give my, the DPT thing. All this vaccine is going to be there, and the live. So I want maybe I can give it along with the other schedule itself, and then complete it in the next schedule separately. So that is the importance. So rotaviral vaccine, definitely yes, I have to give. Why? Because India has got a high incidence of diarrhea, and the third thing why I am it protects against not the incidence of normal diarrhea. It protects against my child getting a severe diarrhea, preventing hospitalizations due to diarrhea. That is the reason why rotaviral has to be given. So hope I've answered all the three word questions which Renu has asked, whether it is important, what happens when she misses the schedule, and whether how many doses she has to complete.
Right. Renu, I hope that gives you a lot of clarity, and you can please go ahead and get the rotavirus second dose for your child now. Doctor, we've seen several cases of vaccines getting delayed, especially this past year due to the pandemic, due to the initial lockdown and the subsequent, a fear of going to hospitals and the difficulty into moving out and going to hospitals. So we also have another question that's coming from a parent related to a delayed vaccine. This question has come in from Kranti, who's writing in from Mumbai. Kranti says, "Hello, doctor. My baby has completed 1 year. As of now, I have followed all the vaccinations from time to time. Only due to this pandemic, polio vaccinations were not regularly available. Is there any risk to my baby's health?"
Polio vaccine, ideally, individually, it was not available as far as I remember. Are you mentioning about the oral polio vaccines? If that is so, as I told you, you can always get it from a government center immediately. We always take the missed vaccination into schedule. But if your child has not got even a single dose of injectable polio, it is high time you go and get it now, because now polio vaccines are available. Actually, during the COVID time, the shortage was only for the injectable polio. Oral polio vaccine was very much available. So I understand that they mean only by the injectable polio, but right now it has become freely available, so you could go and get it. Otherwise, I think it was injectable polio last year was available as a combination vaccine. So it is highly probable that your doctor has given it along with your other schedule, as we already discussed. DT, we discussed only about 6, 10, and 14 weeks. The same vaccine is given at a booster dose of about 1.5 years. So that time your vaccination was also given as an injectable polio. So your doctor would have covered it as a combination vaccine. So you'll have to find out. But if you are mentioning about oral polio vaccine, you can always get it done. It was available freely. And then there was also a pulse polio immunization that happened in Jan 26. So even if you missed it, you can go and get it. One. And with regard to the missed vaccination, see, during the pandemic the situation, most of them did not want to bring their children. They were afraid of the hospital. So we were organizing vaccination clinic. We were organizing separate timing for vaccination. But even then, parents were worried. But in an event that you have missed the schedule, please don't worry. Go to the doctor. The doctor will start from the time you have stopped your vaccination. Say you have finished 16 and 14 weeks, and you have missed out on your measles. 9th month is your measles vaccination, measles, mumps, and rubella. So that vaccination, they will start it from that, even though your child is at 1.5 years now. They will start from that and continue giving it.
Right. So Kranti, I hope that answers your question and questions, similar questions for those parents whose children have had vaccines delayed due to either non-availability or fear of taking your child to the hospital or any other reason over the past year, especially. Doctor, you spoke about how at times babies face fever and other symptoms post administering of a vaccine. So could you, tell us a little bit more in detail about how to, deal with such symptoms. What is the post care required for vaccines in case there is a swelling or in case there are clots? How should a parent handle their child in such circumstances?
Okay, so with regard to the vaccines, the most commonest side effect are fever. They might get be irritable. The child might be crying continuously for a longer period of time. Very rarely they will puke. That is vomiting. So and very rarely they might get loose stools also. So these are all will be there only for 24 to 48 hours. It is very unlikely that it will extend beyond the 48 hours. So if a child is having persistence of these symptoms beyond 3 days, you have to go back to your pediatrician to know what's the issue. It might not have been because of this. It might have been due to a pre-existing issue. Usually the vaccination produces problem only up to this one. The third thing with regard to your post-vaccine, you are telling something about clots. Clots, do you mean the blackish discoloration that comes while we are injecting? So that is because, as I told you, there are different modes of administration, an IM injection and a subcutaneous injection and all that. So a deep IM, there is hip as an oily format. So that has to be given deep. When it is slightly on the upper aspect, then it can produce something like a swelling type of thing. So we don't call it as a clot. That swelling will likely to go away within about 1 or 2 months duration. But if the swelling is persisting, causing pain to the child, or there is a redness, then that is something which you need to worry about. That time you will go and you will have to go back to your pediatrician. So in the post-vaccine care, fever, the vomiting or the symptoms will persist only for about 48 to 72 hours. The site of injections will be very clean. You might have a swelling, but you will not have redness or pain or while touching that place, which is persisting beyond 48 to 72 hours. With regard to the post-vaccine care, there is nothing much except giving the paracetamol when required when they develop these symptoms. Other than that, no particular vaccine, no particular care is essential for you.
Right. Thank you so much, Doctor, for that clarity. Our next question comes in from Meerut, from Binu Rudrapati. Binu says, I have twin sons. They are now 6 months old, and I have lost their vaccination cards in the hospital during my last visit. Please guide me which vaccinations are due for them now onwards up until 1 year.
Yeah, so we had actually stopped exactly at 6, 10, and 14 weeks. So it's an ideal time to continue. We know one more thing I need to insist on all parents is please keep your vaccination card safe. It is your tickets for your child to enter any school, and in all the Western countries, they demand for your vaccination status. See, because the next vaccination which I'm going to tell about for your child now, two things are there. Flu vaccine is given now. Flu vaccine is for preventing the common cold and cold viruses. Initially, we were not making it mandatory, but because of the corona time, we expect all parents to give it, and it is not available in the government side. It is available in the private side. Flu vaccine. Then coming to this is for 6th month and the 7th month. Then we have one vaccination called as a typhoid vaccination. Initially, we were giving at 2 years, then we made it at 9 months, and now we have made it at 6 months to 7 months itself. Why? Because we are seeing typhoid even among the very young of 6 months to 9 months of age group. Typhoid is, it causes fever, it causes all the problems, and when it comes for younger children, the side effects are more. So typhoid vaccination is given at 7 months. Then you have 2 months break in between. At 9 months, you have something called as a measles, mumps, and rubella. Measles is what we tell Mata. It is capable of producing, as I said, it reduces the immunity, it reduces the weight of the child, and capable of bringing down the immune status. And that is why measles can contribute to under 5 mortality. So that is why 9th month vaccination is important. And then, government took the initiative of MR vaccination drive last 2019 in a very big way. Why? Because rubella is one disease that can produce a screening for you. You might not even know that you had fever. But if you are infected, when you're having your baby in your stomach, the baby can go for a severe congenital rubella syndrome where heart problems can occur, your ear problems can occur, so many issues can come. So that is why rubella, it can produce congenital deafness, congenital cataracts, congenital heart problems. So that is why rubella vaccination was taken up in a very big way. But added to that, we have something called as a mumps. Mumps is nothing but you get the swelling on both sides of your cheeks. That is what the mumps. And rarely that usually when the mumps affect us, a significant percentage affects the boy's testis, the ability to produce the sperm. Okay, so that is why mumps, and very rare cases, it can produce autoimmune disease. So that is the reasons we give mumps at about now, measles, mumps, and rubella. MR is given in the government side. Initially, they were giving only measles. Now they have included rubella also. And MMR, measles, mumps, and rubella is given in the private side. So this is at the 9th month. You have at 1 year of age, you have something called as a hepatitis A. This is the jaundice that is spread through the blood. So that is given at 9 months, that 1 year. This is not given in the government side, it is given only in the private side. So after this vaccination, that is flu, typhoid you have the flu, the hepatitis A at 1 year. At 1 year, 3 months, we have again all those are boosters because most of the vaccinations have been completed. What am I going to do is I'm going to boost the already existing immunity. So that one I already have MMR. The one vaccination which I'll introduce at 1 year, 3 months is your chicken pox. So chicken pox is again a mata, but it can produce a big blisters and sometimes it can also cause pneumonia. So that is given at 1 year, 3 months. Second dose is given within 8 weeks. At 1 year, 6 months, all those are booster dose for the DPT vaccine, the pneumonia vaccine, the polio vaccine, which I've given already. With that completes the schedule, if you go and see, of your child. But keep your vaccination safe because the Western countries don't want their measles, mumps, and rubella because they're capable of producing very severe infection in them. So they don't want that. They ask for MMR antibodies. They want to know that their children vaccination, the rubella vaccination is a must for all their children. So they look at that. And they will also want to know your chickenpox titers because your son is going for studies or daughter is going for studies. She's going to be in a closed environment. So they are capable of getting all the brain fever related infections also. So they will insist on MMR vaccination. They insist on DPT vaccination. They also insist on your meningococcal vaccination. So if you already have a vaccination card, this is a proof you have been vaccinated. It is just enough if you're going to attach it and give a booster dose of DPT and meningococcal vaccine alone. But if you're not going to attach them, you're not going to have the vaccination card, you will have to work out on all your antibodies. So keep your vaccination. One of the best thing is always take a photograph because you have cell phone, no, all electronic. You can in fact scan and put it in your mail and keep it. I tell all my parents, have a soft copy of your vaccination after each visit so that you can have it. And after your vaccination is complete, have it laminated and keep it with yourself. And the two other vaccine is your meningococcal vaccine. That is again an optional one. It is not mandatory in India, but till now, whatever the vaccinations have spoken, it is definitely needed. But government has decided that it is able to give only certain vaccine. The rest of the vaccination, if you are affordable, I mean not a very rich people. If you are able to spend 2,000 or 3,000 rupees also, which we will be doing for our child, please go and get the vaccination because vaccinations will help you prevent against deadly diseases only. We are not talking about the normal diseases.
Right. Doctor, I observed that you mentioned that the flu vaccine, which was earlier an optional vaccine, has now been mandated due to the coronavirus ongoing pandemic. So could you, shed some more light on this flu vaccine and why is it important? And even if it becomes, no longer mandatory, should you as a parent, opt for this vaccine for your child?
Yeah, flu vaccine, as I told you, is against the influenza virus. So you get the common cold with every child gets it, right? But if you see, there are 90 million new influenza episodes every year. And because of which I told you the influenza virus forms the path over which all the bacteria are sitting and can cause pneumonia. So this can cause 1 million new pneumonia and more than a lakh death. This is what we're talking about in corona. Corona, you get it as a common cold only. The corona is capable of producing the pneumonia, which is causing the death, right? So flu is, in fact, capable of this. The difference between flu and corona is only the infectivity profile is not so much like in corona. The infectivity rate is not more, the severity is less. Other than that, it can equally produce the problem. And in Western countries, they are more bothered because they have influenza pandemic and epidemic going on for them, which can easily convert it to pneumonia. Why you should vaccinate your child is your child, when you deliver it to the daycare center, it will be protected against a common cold from other children. First point. Second point, if you have an elderly parent in the house, so this is called as a reverse infection. So this child, usually when will the child get affected? The child always gets affected from the adults to the child. But this is one infection where your parents can get infected from your child. For them, the influenza can be very detrimental, can cause severe pneumonia. So you protect your child. You are not only protecting your kid from the flu, you are also protecting your parents also from the flu. Even in corona, if you have seen, we were more bothered about our elders. We were telling them be safe. We were not allowing them every time. And even now, the vaccination drive, the preference is given for senior citizens because the pneumonia is a killer disease for them. So the pneumonia is a killer disease for under 5 and 65 years. So what is the start of the killer disease is these flu viruses which starts. So the flu vaccine has become mandatory. So we cannot give back. Corona vaccine is yet not come in the pediatric age group because we have not seen any serious side effect of the vaccination is yet to be approved in the pediatric age group. So we are advising them at least now get the flu vaccine so that the normal cold cough situation will not come in your child so that it does not become pneumonia.
Right, there you have it from Dr. Narmada Ashok on why of administering the flu vaccine is important for your child. Doctor, you have, throughout today's workshop, you mentioned, that there are certain vaccines that are, available in government facilities, and then there are some that are only available in private facilities. For those vaccines where there is an option to have them administered in a government facility or in a private facility, which facility should a parent opt for? Is there any difference between having them administered in a government facility vis-a-vis a private facility?
Yeah, see, for example, in a government facility, I give DPT, hepatitis B, and Hep. There I get the wholesale vaccine. So you don't have a choice of about painless vaccine or a pain vaccine one. So you need to choose on that one thing. Second thing is about the pneumonia vaccine. In those states where pneumonia vaccine is not given as a mandatory vaccination, then probably you will get the DPT vaccination in government schedule. Then you'll have to come back to the private sector to get it done. So one thing. Third thing, the availability of polio vaccine. Some government sectors, polio vaccine is sometimes not available in the, as they said, they already had an issue with it. But whereas we give us a combination vaccine with the DPT and all that. Nowadays, government has made it mandatory that polio vaccination is available. But in eventuality where it was not available, we give us a combination vaccine along with the DPT. So the advantage of doing it in private sector is one is your choice to choose between painless and pain. The other thing whether to this confusion comes only with regard to DPT MR. Okay, after that the vaccines are not in the 1.5 years also government gives only DPT. It does not give any pneumonia vaccines also. So for you to get the vaccination completed, you might have to come to the private sector. So that is why I'm talking about this one. So the difference between painless and pain, what you want to choose. The second thing, the availability of the polio vaccine as a combination vaccine. So these two only makes you to be going in for a private. Otherwise, government absolutely fine. The vaccine is fantastic.
Right. I think you've clarified all the doubts, we as parents had in mind related to vaccines, especially for newborns. So before we conclude today's workshop, Dr. Narmada, is there anything that you'd like to remind parents of newborns to keep in mind when it comes to their babies' vaccinations?
So as I told you, that with regard to the vaccinations, they will have to know that it is mandatory to get the vaccination. That is there. Please don't get confused with all the whatever the claims. You have to see what everything old was definitely good. I will also say it was good, no doubt about it. But let me say the mortality rate has significantly come down. Thanks to vaccination, clear water supply, clean water supply, our life standards have increased. So please don't keep comparing. If grandparents have not got, why should my child get? Let it get a natural immunity. Some natural infections are costlier. It might not be remaining the same. So please ensure that you get vaccinated. Don't believe whatever is given in the WhatsApp or in your social media. See, there are a lot of awareness programs there which you are having with experienced and qualified people. And you have your pediatrician round the corner. You can always get it clarified from them and please give your child the vaccination. Third thing, there are certain side effects of it. We are not assuring you. We are trying, the research has been trying to bring down the side effects. But that might be there. That is a part of it. So do accept it and be aware of the normal side effects which happens during the vaccination. You also should know what is abnormal. Having a child with a fever for 7 days and telling that I got vaccinated last week is not normal. So you should know what is the normal duration of side effects. So go and ask your pediatrician what are the side effects you can expect, how long to expect, and how much to have it. So that will give a clarity for you. So don't get confused. Have the clarity of thought. There are a lot of literatures available, and I think we have discussed more on the political aspects also of vaccination. So it is very interesting when you start reading it, you can understand. So that one, and then get your doubts as and when clarified. Know when is the side effects, when not to postpone things.
Right. Thank you so much, Dr. Narmada Ashok, for educating all of us today. And you can, if you've enjoyed this Parentune workshop, do subscribe to the Parentune Plus membership program, where we will be coming back to you with lots of such informative and helpful workshops with our Parentune experts. Take good care and see you on the next Parentune Live. Once again,
Thank
thanks,
you.
Dr. Narmada.
This is also fun for me too interacting with you. Thanks a lot.
Goodbye.
Mhm.